We're staffed 24 hours a day with physician and RNs. All of the RNs have TNCC, ACLS, PALS, and BLS, that's trauma nursing, and the advanced life support certs. The facility can do CAT scans, MRIs, surgery, and our trauma patients can go into ICU. We do have specialized equipment, you guys can read. Specialized equipment to kind of help the flow, as Mike said. We kind of do it all. We don't have the intubation team, we don't have the stroke team, we don't have a cardiac team. We do it all. We, do all the clot busters. We do use telestroke now, so that's been helpful. We have the rapid infuser. There's actually, we have a helipad and Lifeline 4 docks here in Lahana. So at AVRMC, we keep the patients that are appropriate. We have the med-surg unit, ICU, and OB units. We do have surgical services and orthopedic services. It's Dr. Jackson and Dr. Morley. We do outpatient rehab. Our specialty clinics right now, on our last calendar, we have audiology coming in, podiatry, cardiology, pediatric cardiology, pulmonology, oncology, nephrology, and ENT. So because we are rural, we really try to make those relationships. Our senior leadership team, Heidi and those folks have done a really good job reaching out to specialty clinics to come in, because we understand it's a hardship for people in a rural area to have to keep driving, even if it's an hour to Pueblo. And most times it's more than that if it's a specialty. So trauma accounts for 38 million emergency visits, 2.3 admissions annually, that's nationwide. Trauma accounts for 30% of deaths in the US yearly. In 2014, that was the latest I could find. Deaths due to injury were 192,000. Trauma continues to be ranked as the #1 cause of death for those one-year-olds to 46, and third for all age groups. 2.5 million older people are treated for falls annually. 250,000 are hospitalized for hip fractures. That is our biggest trauma number, is falls, is elderly falls, hip fractures. Dr. Morley is really good if he can get them in and it's appropriate to do those hip fractures here. Again, it's usually the elderly population, and it is a hardship for them to drive. So many of those that we can help here, we do. We just thought those were some cool pictures because it is rural trauma, and you never know. So most high-risk trauma patients injured in rural areas are cared for outside of the major trauma areas, the big trauma centers. So for those of you that don't understand designation, just because you have a car accident, maybe they have a cracked skull and something's leaking, we don't have the luxury of thinking, oh, we're gonna go straight to that level 1 trauma. They come here as a level 4, and we stabilize and get those patients packaged up, we call it packaged up, so that we can safely transport them to the care that they need. So we see every kind of trauma under the sun, we just have less resources than the big trauma centers. The fatal crash rate is more than twice as high in rural areas. I would like to point out here that we also, from the Trinidad to the Lahana corridor, we've had some major car accidents of multiple people with, I don't know if you call it human trafficking, or it's kind of how we treat it. A lot of non-English speaking. So that's a big challenge. We do have Marty that can translate for us, and we do have translators certified here in the hospital so that they can come, so that we can make sure that we encompass all of that care also. So our EMS partners, we get with the transfers that we get, motor vehicle crashes, falls, we get lots of farm and ranch assaults. That number is growing. Gunshot wounds and stabbings, that number is growing. We do get different burns because of the ranching and recreational accidents. There are several recreational lakes around, so we get accidents in from there. This is a big hunting region, so we get those kind of traumas in during dove season. Starts September 1. That's the one I remember. It's the one Okay, so the great thing about our EMS, and thank you Brad for having your guys come, all of the EMS agencies were invited, because everybody knows it's busy. They are great at helping us. When they bring in patients and they see that we're stacked up, it's not beyond them to clean beds, you know, to help us turn over rooms. And so I think that's one of the great things about rural emergency is that you're one team, and everybody understands that. We are also an EMS student clinical site. We let the EMT students for both basic and, it's called advanced now, not intermediate. They come in, we do hundreds of hours of EMT students every year. And our philosophy is, we want to make them the best that they can be, and we want them to understand what happens once you drop them off here. Gives them a different perspective. So, in 2022, we had 2,000, I can't remember the full transports. Lahana Rural was our biggest customer. They brought 936 patients to us. Rocky Ford brought 560, and Bank County brought 552. Also, we regularly receive transports from Kim Ambulance, which is an hour south from us, Crowley County, which is about 45 minutes north of us, MedTrans, which is just the long-term transport team, but they do like some nursing home transports for us. Fowler Ambulance is another 40 minutes away, and Hasty McClave Ambulance actually comes to us, and they're about 45 minutes away. So within a 60-mile radius, we get ambulances from everywhere. We do provide the educational opportunities. Christy is our site coordinator for All American Heart. So she does lots of the advanced cardiac and the pediatric advanced cardiac classes throughout the valley to help the agencies out. The classes that we bring in to AVRMC are the ACLS, PALS, TNCC, emergency nurse, pediatric, basic life you can get here, ASLS, and we have done the burn. Haven't done that since the thing. So we are in the level 4. We are committed to the community. Everybody that is in the ER is from the community. We train our nurses that you are part of the community, and there's a good chance it's going to be your dad or your dad's best friend, or your son or your son's best friend. And that's the hard thing about meeting your ambulance tones, is there's always a good chance you're going to know who's coming in. Our outreach was kind of shut down for the last 3 years. We did still do the CPR in the community. Christy still did do the ACLS and the PALS. The emergency room actually takes part in Girls in the Middle. It's for STEM, for like middle school girls. This year and last year, we did CPR. We just took the dummies so they could get used to that, get excited about it. And this year we also took our EZIO, so they could feel drilling into, you know, the fake bones. So we're really trying to get our community engaged at that age, so that as they start deciding what they want to be when they grow up, they know that we're a good option. And then we were able to do the health fair again this year. Of course, that stopped for 2 or 3 years. We do education and agency in the community. I work with Hannah a lot. If we have cases that we need to go over, if we find something that maybe we can help. We are a member of Southeastern RETAC. We have been a member since the inception of RETAC. So that Southeast region, and also the council secretary for the Otero County EMS. And with the police departments, Chief Quick has graciously let us be part of the City of Lahana Emergency Response Committee. We have those meetings approximately every quarter, and we're going over MCIs and how are we going to respond to that, and what does that look like from the first call to when they come through our doors, and how do we activate the state and all of that. So these are the criteria for level 1 for an adult. EMS has our criteria in their rigs. We're getting ready to update our criteria, so those will go out to the rigs, so they have to be updated, so they know what they can activate in the field to get us ready. Pediatric. And then this is the level 2 criteria for both. Interestingly enough, we get a lot of the thrown kicked or stepped on by a horse or bull. A lot. We always encourage the staff, if you're not sure, go ahead and call it. It's always good practice. So trauma versus medical patients, AVRMC's ER had 10,894 patients come through its doors last year, and of those, 2,549 were trauma patients. So for being as small as we are, we actually have a bigger volume than a lot of rural areas. 30 level 1 activations and 143 level 2 activations. For the process improvement that we've done since the last designation, we did add Christy as a trauma document specialist. She's been a huge help getting those second level reviews done for me. We actively always review the trauma policies, the activation criteria. Again, we're getting ready to update that a little bit to kind of fit the needs of us. We added physician QI. We've always done nurse QI, but we've added physician QI with some of the triggers as not calling a surgeon or not doing a consult within the 2 hours, not getting them out within the 4 hours with no documentation that actually supports why that happened. And the trauma medical director now also reviews all of the blood products that you, Dr. Grady, any of the trauma admits to ICU, all of the people. So, trauma care is the area in which we can make the largest impact on the patient's final outcome. And again, I'm very grateful that we can work so well with EMS. I feel like we all bring a lot to the table. And as you can see, there's many different areas that support the program within the hospital. We have a really good team of talking to make sure what's best for the patient and change what we need to. So,
Thank you.
That's our overview.